Cognitive Theory in Advanced Generalist Social Work Practice, presented by Topacio Quesada, Ashley Klunk, Carrie Tuggle-Nord, Camille Kempton, and Treasure Kim. Cognitive theory builds on behavioral therapy by suggesting that thoughts, not just the consequences, influence behavior. CBT utilizes cognitive and behavioral therapy to address psychological distress by looking more closely at the learning process regarding the distress. CBT is grounded in the basic ideas that our thoughts influence our emotions and that our behavior can influence our emotions. Cognitive theory practice principles. These practice principles are utilized to help ensure the effectiveness of the theory. Engagement focuses on building positive relationships with children, adults, families, and communities. Assessment focuses on information collected in the interviewing process that better helps the social worker understand the client's situation. Goal setting is the process in which the intervention takes place and the development is easily tracked and objectives are easily seen. Intervention correlates directly with the effort made by both parties to create change and accomplish goals. The termination process is the closing of the relationship between the client and social worker. Lastly, the evaluation aspect is when the social worker evaluates how the interventions assisted the client in moving towards their goal attainment. Cognitive theory in practice. Cognitive theory is best suited to be used in macro practice due to the focus on the individual and their immediate systems rather than how the individual is influenced by macro systems. Cognitive therapy is typically best utilized for clients with the following concerns: depression, anxiety, phobias, PTSD, and substance abuse. Since cognitive theory can be applied to all of these concerns, there is a large variety of practice settings in which it can be effectively applied. Due to the wide range of client populations that cognitive theory practice can be applied to, there is a wide range of practice settings it can be utilized in. These practice settings include private practice, group homes, transitional living facilities, school counseling, and inpatient facilities. CBT is one of the most widely used interventions in social work settings. It can be used with children, adolescents, young and middle-aged adults, and older adults with a variety of concerns and diagnoses. Due to these factors, it can be utilized in a wide variety of practice settings to include the practice settings noted previously. Client fit should always be considered, as some clients will benefit from cognitive therapy and others may not. It was previously believed that clients with dementia, delusions, or thought disorders would not benefit from cognitive therapy. However, this has been disproven if practiced in combination with strategic training. Clients who are organized, follow through, and are good planners tend to have more success with cognitive therapy. Unfortunately, clients who are rigid in their thinking or who experience excessive anger do not typically make a lot of progress with cognitive therapy. Based on the client's specific needs, they will benefit best from a specific modality to address these needs. Some of the specialized interventions include trauma-focused CBT, brief CBT, Beck's model of cognitive therapy, rational emotive therapy, cognitive processing therapy, and mindfulness-based cognitive therapy. Cognitive therapy strengths. There are many strengths of cognitive and behavioral theories. One of the greatest strengths is a diverse group of individuals that may be treated with using CBT. It has been proven to be effective when treating depression, anxiety, anger management, and social phobias, PTSD, bulimia, schizophrenia, OCD, and also different types of childhood internalizing disorders, and many more. When using cognitive and behavioral therapies, there are suggested explanations and interventions for many different client situations. Some social workers may enjoy utilizing these theories due to their clear principles and concepts that can be learned through proper training. CBT is manualized and flexible for many diverse client groups. It can be used when working with almost any age group, including young children all the way through older adulthood. CBT has been proven effective for nearly all client groups due to the flexible nature. The correct use should be used by a practitioner and specific to the client's need due to many different forms of CBT. For example, a client with PTSD would need to be treated with trauma-focused cognitive behavioral therapy to ensure sensitivity to the client's needs. Cognitive theory limitations. There are some limitations to cognitive and behavioral therapies. They tend to focus on the individual functioning and pay little attention to the macro influences. Conventional theories focus on the individual and closed systems. Another concern is that methods seeking to change thoughts and behaviors may give too much authority to the practitioner. Early implementation was founded in the idea that the practitioner is the expert on how to best make changes. There is a danger that the use of CBT may replicate the experience of colonization by requiring marginalized groups to adapt to the social norms and values of the dominant society. When working with unserved population, there are risks that interventions may be used to impose values inconsistent with the worldview of a child, adult, family, or community within those populations. Limitations have important implications for social work practitioners. Cognitive and behavioral theories may be less helpful for practitioners working on meso or micro levels. They may not adhere to social work values of self-determination and a client's right to autonomy. Care must be taken when working with unprivileged groups such as children and people of color, and also understand the potential risk of imposing values on others. As advocates for social justice, practitioners must understand the potential risks of using CBT interventions as a way to impose values on others. This could be intentional with malintent or unknowingly done by a well-meaning practitioner. It is important that practitioners are mindful of this so they can prevent the use of silence the voices and alter voices of those we serve. Care must be taken when working with unprivileged groups such as children and people of color to ensure that practitioner is employing interventions according to the social work mission and values. There is a risk that a client may feel marginalized, disrespected, and even bullied if the practitioner takes an authoritative approach. This is of particular risk in client systems that have experienced past oppression, both personal and historical. To honor an individual's dignity and self-worth, particular attention should be made to ensure the principles of self-determination and client as expert are honored. To further uphold principles around the interconnectedness of systems, a person in environment perspective is vital as a lens through which is to use CBT. Thank you for your time.